Every week, a new physician surfaces online explaining why they walked away. AI is closing in on their role. Burnout has hit record highs. The system is falling apart. So before you commit a decade of training to a career in medicine, it's fair to wonder, is there any actual reason for optimism? Turns out yes, but only in certain corners. Jordan Jubble, MedSchoolInsiders.com. In 2026, doctors across 29 specialties were polled on how optimistic they felt about their field's long-term outlook. Most weren't buying it. 25 of those 29 specialties had less than half their physicians expressing optimism, but not every path in medicine looked so grim. Here are the specialties where doctors feel the most hopeful. Two specialties tied for fifth place at 49% optimism, and for very different reasons. Neurologists diagnose and manage disorders affecting the brain, spinal cord, and nervous system. Demand keeps climbing alongside an aging population, and the field has made real strides in treatment options over the past several years, giving physicians far more tools than they had 10 years back. Preventive medicine physicians focus on keeping patients well before illness sets in. It's a growing field picking up real steam as patients and health systems shift their focus toward prevention rather than reaction. Longevity medicine, lifestyle medicine, population health, the cultural tide is flowing this direction. ENT physicians treat conditions of the ears, nose, and throat, along with structures in the head and neck. The specialty consistently sits near the bottom for burnout among surgical fields, at 43%. Average pay tops $520,000 a year. The work is procedure-heavy, results tend to be favorable, and the hands-on surgical element of ENT provides genuine protection from automation worries. Plastic surgeons repair and rebuild tissue, everything from trauma reconstruction to cosmetic work. This specialty holds the lowest burnout rate in all of medicine at 37%, with average earnings above $620,000. There are two branches of plastic surgery: reconstructive, which restores form and function following injury, illness, or birth defects, and aesthetic, which improves appearance in patients who are otherwise healthy. Aesthetic work is elective and paid out of pocket, meaning fewer insurance headaches and more autonomy over how you structure your practice. The manual precision and artistic eye this specialty requires aren't easily absorbed by a machine. You're working with your hands in a highly deliberate way, something AI can't easily replicate, at least not yet. Psychiatrists diagnose and manage mental health conditions spanning anxiety and depression to schizophrenia and bipolar disorder. The AI conversation in mental health is very real. New tools keep appearing, and some researchers have raised genuine concerns about where AI is headed in psychiatric diagnosis. And yet, psychiatrists themselves report feeling optimistic, which is notable. A few factors might explain this. Demand for mental health care has surged, and the provider shortage remains severe. Whatever AI is doing on the margins, it hasn't closed that gap. Patients still want a human sitting across from them, and the legal and clinical liability tied to unsupervised AI in high-stakes mental health scenarios remains unsettled. That said, newer research suggests AI can mimic empathy and human rapport better than most people assume, meaning the long-term trajectory may be shakier than psychiatrists currently believe. Oncologists treat cancer, overseeing chemotherapy, immunotherapy, targeted treatments, and the entire span of a patient's journey through one of medicine's toughest diagnoses. At 70%, they're not merely the most optimistic specialty in the survey, they lead by a 13-point margin, with psychiatry coming in second at 57%. Cancer diagnoses in North America are expected to climb 56% between 2022 and 2050. The oncologist shortage already tops 2,000 physicians, and just 14.5% of practicing oncologists are under 40. One surveyed oncologist put it plainly: demand will keep rising alongside an aging population, and the shortage hits rural areas especially hard. As for AI, oncologists aren't anxious about it, they're embracing it. From reading imaging to handling documentation to shaping treatment plans, AI is giving an already stretched-thin field more bandwidth to keep pace with demand that shows no sign of slowing. If you want the complete picture of what a career in oncology actually involves, day-to-day and all, click up here. Or check out this video to see how AI is reshaping medical school admissions entirely. It's getting tougher, and you need to know how to keep up.